Okay. As usual, we're going to give it just a couple of minutes for people to get logged on. Yeah, I know that we do have additional people that are registered for the session, but we are 2 minutes after, so I'll go ahead and get started with the housekeeping items. I will just wait a moment because it looks like we may have lost someone.
Are you the one presenting again, Kristin?
Yes, it's me.
Okay.
And we're just waiting a minute for people to log on. It has taken a couple of minutes for the last couple of sessions for people to get logged onto it. So we're waiting.
Yep, that works.
Okay. Now I will go through the housekeeping items. So this is session 4. We're going to be talking about monitoring zoonotic diseases that have pandemic potential today. So just those housekeeping items, the session is being recorded, transcription is enabled, the chat is being monitored, and the Q&A feature is enabled. So feel free to use either of those options at any point throughout the presentation. And our presenter today, again, is Kristin Langedyke from our epidemiology department. Did a fantastic presentation last week. If you were not here for that, that will be posted on our YouTube after it's reviewed. And today's presentation is also going to be awesome. So let me stop sharing so that Kristin can take over.
Thank you, Lori. Let's see if my voice holds up today. All right, all good. So welcome and thank you for being here today. You can see my slides, right, Lori?
Yep.
Okay. Also, thank you, BHP, for having me be a part of this webinar series. My name is Kristin, and I'm an epidemiologist for Southeastern Idaho Public Health. My education is in biomedical science, and I've worked in cadaver labs, did an internship with a pathology lab, and I was a deputy coroner for Bingham County, where I did some education through the University of North Dakota on death investigation, and I was able to assist in a few autopsies. So a lot of my experience is through the pathology lens, which is great for studying diseases. A lot of people, I came to public health through the COVID-19 pandemic, first as a COVID investigator and then becoming an epidemiologist here at SIF. I'm honored to be here today and hopefully teach you all something about monitoring zoonotic threats with pandemic potential. So how do pandemics happen? The first step is often spillover. When a pathogen crosses from animals to humans, spillover risk increases with wildlife encroachment, agricultural, agriculture intensification and animal trade, as well as environmental disruptions. Mutations can also occur. It's when a pathogen, so a pathogen often spills over when there's been the appropriate mutation to exist in humans or other animals other than the primary host or reservoir. Pathogens may also mutate or adapt in ways that improve survival or transmission in humans, and repeated exposure opportunities increase adaptation chances. Lack of population immunity, no vaccines or prior exposure means fewer barriers to transmission. If humans have little or no existing immunity, the pathogen can spread rapidly through populations. Novel pathogens encountering a fully susceptible population will likely spread quickly. We saw this mostly with COVID-19. Global travel, modern transportation allows outbreaks to spread internationally before they are even recognized. Local outbreaks can become international within a few days. We saw this with the current hantavirus cruise ship situation. While it's not a pandemic and containment and awareness in that event is high and well managed, it did become a multi-country outbreak. There's also been a lot of preparation with the World Cup happening soon in the US. So yeah, while many zoonotic threats seem far away, often they're just an airplane or a car ride away from us. And then lastly, asymptomatic and pre-symptomatic spread. Diseases become especially difficult to contain when infected individuals can spread illness before they realize they are sick. Delayed detection and silent transmission chains make containment much harder. There's a lot of work being done to identify future disease hotspots, including an infectious disease vulnerability index that includes these factors. Well, we're not going to go into that index. I just wanted to mention it so that people are aware that, there's people out there tracking all this. All right, and so what makes a disease a pandemic threat? Not every zoonotic disease becomes an epidemic or a pandemic. Most spillover events burn out quickly. Pandemic threats usually share several characteristics that make containment difficulty. These are high transmissibility. The most important factor is usually how efficient a pathogen spreads between hosts. We call this R0. It's depicted with this like R0. And qualities like airborne spread, close contact spread, and diseases spread by vectors often contribute to high transmissibility. You can see R0 examples with the image provided. Measles is widely considered the most contagious disease known to humans, and you can see it there in the bottom right, this an R0 of 16. Here's COVID-19 with 2.5, and flu is this middle one. All right, high mortality or severe disease burden. A disease doesn't have to be extremely lethal to cause a pandemic, but severe disease increases healthcare strain, economic disruption, and public concern. Moderate mortality with high spread can be worse than extreme mortality with poor transmission. Essentially, if a pathogen kills off its host, it can't spread to the next host. So having like a mid-tier with high transmissibility can cause more pandemics, essentially. Naive population. When a population has little or no pre-existing immunity, pathogens can spread rapidly. Animal reservoirs that are difficult to control. If a pathogen persists in wildlife, livestock, or vectors, eradication becomes extremely challenging. Bats, migratory birds, rodents, mosquitoes, they're all good examples. High mutation potential. RNA viruses especially can evolve quickly, adapting to new hosts or transmission pathways. H5N1 and influenza are good examples. And then limited countermeasures. If vaccines, diagnostics, or treatments are unavailable, delayed or ineffective outbreaks become much harder to contain. And pandemics are usually not caused by a single factor, but several dangerous characteristics occurring together. All right, here's an image of factors that contribute to zoonotic spillover. So like encroachment into natural ecosystems, this kind of heightens our exposure to species that carry disease. Here, of course, is our rapid global travel and trade. Mutations is down here. And then, of course, our human, animal, and wildlife interfaces with like animal markets or livestock handling. All right, and here is kind of a diagram of the process of spillover, essentially, and amplifying into a pandemic. But you can also see chain of transmission in this photo, which is kind of why I wanted to highlight it. So, there's changes happening. We start interfacing with animals, and so there would be like spillover here. And then we start spreading it, and the impact can be amplified by like conflicts or disasters, especially when we talk about mass care. That can, like with low resources, it can make essentially the effects of like an outbreak more serious or amplified or spread more. And yeah, so that's kind of a good image for the amplification to spill over to spread, but also where we can interrupt chains of transmission throughout it all. All right, so I'm going to move into some specific diseases as an example of what's out there, what to look out for, and what's being done. First, we're going to look at New World screwworm. It's a parasitic fly whose larvae consumes living tissue, and it affects livestock, wildlife, pets, and occasionally humans. And it can have severe animal welfare and agricultural impact. It was historically eradicated from the US, but it remains a reintroduction concern. So we're including this one because the epidemic potential for livestock is highly feared. It doesn't necessarily have a reservoir since it is the problem. The transmission occurs when an adult female fly lays eggs in the open wounds of warm-blooded animals. The larvae hatch and burrow, causing more severe wounds, and that attracts more flies. And then it travels geographically via the natural flight of the fly, or it's transported like in infested animals being transported for trade. And why is it a public health concern? It can spread rapidly in susceptible livestock populations, causes massive economic damage to the agricultural industry. It can infect humans, and it requires aggressive containment and surveillance. Essentially, it takes a lot of resources to contain, which further taxes the healthcare and public health systems. And it is currently located in Central and South America and the Caribbean. There has been a reemergence in Central America as well as North America, specifically Mexico. We're going to talk about that outbreak here in a second. All right, so preventing New World screwworm, rapid detection and reporting so we can take action is always important. Animal movement control. This can be like quarantine and isolation, restricting transport and monitoring high-risk entry points like a border. Wound management, so the flies don't have access to, they essentially can't infect the animals and complete their life cycle. So you want to properly take care of wounds. Surveillance trapping is interesting. Surveillance trapping uses specialized traps to monitor insects or vector populations for invasive species, disease vectors, emerging outbreaks, and like monitoring the geographic spread of these vectors and populations. And it acts as an early warning system for public health and agriculture. So like if we suddenly see a mosquito that's carrying a certain, West Nile or something in our area that wasn't here before, then we can be on alert for the disease to be in our population as well, in humans. All right, and sterile insect technique. This is a biological control method where large numbers of sterile male insects are released into the environment. Females mate with the sterile males and no viable offspring are produced. The screwworm females only mate once in their lifetime. So eventually this method will lead to population collapse, interrupting the chain of transmission. Animal movement and sterile insect technique are currently being used to keep the outbreak of the New World screwworm in Mexico from spreading to the US. The USDA closed the border to livestock imports from Mexico due to the northward spread of the New World screwworm. And the USDA and Mexican authorities are conducting joint operations to help stop the spread, primarily using the sterile insect technique. And a key surveillance point, or what to look out for, is unusual maggot infestations in living tissue. Those should be reported immediately. All right, so H5N1 or bird flu, we're dealing with an RNA virus, so we're thinking of a high chance of mutation. This pathogen causes severe disease in birds. There is increasing spillover into mammals that is raising concern. And there's also significant pandemic potential if human transmission adapts. It's located globally in birds, though in humans, recent infections have been in Cambodia, India, Mexico, and Vietnam. In 2025, last year, other countries, including Bangladesh, China, the United Kingdom, and the United States had human cases. The reservoir is wild aquatic birds and wild waterfowl. Transmission occurs between infected birds and other animals, contact with virus-contaminated environments, or animal byproducts, or by air droplets or dust if the viral particles are in them. So why is public health concerned? H5N1 is an RNA virus, so of course the high mutation reassortment potential. The host range is expanding. Human infections, while rare, occur. Primarily, it's individuals that work in a field that has the bird-human interface. So think like poultry workers. And then the main concern is the potential for an adaptation to happen that makes human transmission sustained. All right, so mitigation measures for bird flu, biosecurity in poultry livestock operations. We covered this more in depth last week, but essentially taking measures in keeping like wild birds and contaminants out of your flock is biosecurity. Surveillance and testing, routine testing and surveillance can give us an idea of migration patterns and seasonality with bird flu, so we know where and when to amplify prevention efforts. Isolation and culling of infected flocks to break the chain of transmission. Also proper disposal of infected carcasses. We know like birds can pretty much get everywhere, so we don't want scavengers and other birds interacting with those infected carcasses. PPE for workers to prevent human infections. This is important in preventing the virus from adapting to us as well. If it's not contacting us, it won't learn to adapt. Rapid reporting to animal health and public health authorities. This aids in the speed in which intervention can happen. So like the right people can get in to do any of these kind of methods in prevention. All right, and the key surveillance point is sudden bird die-offs or severe respiratory disease clusters. We want to immediately investigate those for respiratory, well, just like flu types in general, but especially bird flu right now. All right, so the Nipah virus, why it matters. It's a zoonotic virus with high mortality. Around 40 to 70% of people with Nipah die. Bats are the reservoir. It causes severe respiratory and neurological disease, and human-to-human transmission has occurred. And here's an image. We're going to go into more detail about the transmission, but you can see that like direct contact with handling the bats, transmission via food, especially fruit, and then transmission through intermediate hosts. There has been a big outbreak that was a historic outbreak, not recent, through pigs. And then also down here, they show a human-to-human spread. They label this guy a super spreader, as if he's like in a hospital spreading it. So yeah, that's kind of all the transmission modes of Nipah. All right, so the primary reservoir is fruit bats, and transmission occurs by direct contact with infected animals like pigs or bats. Consuming food or drinks that are contaminated by the infected animals. Remember fruit and fruit bats, it kind of makes contamination easy that way. Spillover often occurs at the livestock-human interface. And then lastly, close contact with body fluids from an infected person can transmit the virus. Person to person or human to human. And public health is concerned because of the high case fatality rates. Limited treatment options. There are no licensed treatments for Nipah. It's limited to supportive care. The pandemic concern due to its potential adaptation. Nipah checks a lot of the pandemic potential boxes like high mortality, limited immunity, wildlife reservoirs, emerging spillover, human-to-human transmission potential, and then of course limited countermeasures. Lastly, Nipah demonstrates the importance of taking a One Health approach to prevention. We'll discuss One Health more later, but this pathogen is a strong example of how environmental disruption can influence emerging disease risk, and intervening before spillover is incredibly important. And so location Nipah outbreaks have only been reported from Bangladesh, India, Malaysia, the Philippines, and Singapore. However, the fruit bats that carry the virus are often found throughout Asia, the South Pacific, and Australia. All right, so mitigation methods. Because there are limited treatment options, prevention and surveillance become extremely important. Surveillance in wildlife and livestock give us kind of early warning signs. Reducing exposure to contaminated food products, isolation and infection control, rapid identification and reporting of clusters so the spread can be stopped. And then, of course, key surveillance points, unusual neurological or respiratory outbreaks with animal exposure history should raise concern for emerging zoonotic disease. And this is, pretty prevalent with most zoonotic diseases, is you want to see if there's animal exposure and someone's sick. It doesn't necessarily have to be neurologic or respiratory. You want to start asking some questions about zoonotic disease and not other disease. And so while we're obviously unlikely to see Nipah in Idaho, the disease is important because it demonstrates the mechanics by which emerging zoonotic pandemics develop. Mechanisms like wildlife reservoirs, environmental disruption, livestock amplification, viral adaptation, human-to-human transmission, and delayed detection can all combine localized, and so essentially turn localized spillover into a larger event or an epidemic or pandemic. All right, here are some other threats. I know that some of these viral and bacterial are vector-borne and some vector-borne are viral, but this slide is just to give you an idea that of what zoonotic threats are out there. Not all of these pathogens are equally likely to cause a true global pandemic, but each has a characteristic that makes public health officials monitor them closely for outbreak or pandemic potential. We'll look at some spillover monitoring later that details these characteristics more thoroughly. All right, so what triggers concern, or what should you keep in mind? So unusual severity. If there's like rapid deterioration, severe neurological or respiratory signs, animals failing to respond to treatment, even common diseases behaving uncommonly deserve attention. Clusters of disease, if we see multiple sick animals in a household, shelter, livestock cases, kind of all appearing simultaneously, or similar syndromes across multiple facilities. Patterns across time, location, or populations often signal like emerging problems. Unusual species involvement, pathogens appearing in unexpected hosts may indicate adaptation or spillover. An example would be bird flu in animals, in mammals. And cross-species transmission often is often where major zoonotic concern begins. Geographic and seasonal anomalies, diseases occurring outside of their normal range or season can indicate changing ecology or emerging spread. With climates changing, warming, and shifting, we'll see all life forms shift to animals, plants, and insects. This means we might get a vector down south moving up to regions it hasn't existed before, bringing its diseases with it, or earlier seasons like this year with ticks showing up earlier and more plentiful due to our warm winter. So that's kind of how seasonal anomalies will look like. Human exposure, this one's pretty self-explanatory. War is concerned when a human gets sick. So concurrent illness in humans and animals is always something that should trigger concern, especially people who work with the animal interface, back to the poultry workers and bird flu as an example. And then lastly, unexplained illness. When illness doesn't fit normal patterns, continued investigation is important. Some actionable items if you do have concerns, or if you do suddenly see, like a animal that has bird flu in it. Appropriate use of PPE to protect yourself is incredibly important, especially, if you're kind of like the front line, the first person noticing it, make sure that you're protected. Limit exposure, so quarantine and isolate the sick animals or person if it's a person. Document findings clearly and carefully, so if there is a response, that data can be used to find results and help and get help fast. And then lastly, report what you're seeing. Contact the appropriate animal or public health authorities when you're suspicious of a zoonotic pathogen. All right, so mitigation measures this is essentially for all zoonotic, not just the 3 we talked about. So how do we stop or contain outbreaks? The primary idea is to break the chain of transmission as early as possible in the line. For example, if we stop spillover from even happening, we won't see a novel zoonotic emergence at all. So early recognition of unusual disease events. Rapid reporting and surveillance helps us identify potential or small outbreaks and then stop them before they get bigger. Isolation and quarantine protocols, of course, breaks the chain of transmission, essentially by not allowing the pathogen a new host to spread to. Appropriate PPE and biosecurity, protecting yourself, and in the case of biosecurity, protecting your flock and other animals from animals or vectors that might carry disease. If anyone is in need of PPE, you can contact our Public Health Preparedness Department or Lori or Tabari, and we may be able to provide or find a source for you. So keep that in mind, we're a good partner. Vaccination, of course, reduces severe illness and aids in disease prevention by teaching your immune system how to fight off future infections. Of course, herd immunity is the goal to stop the spread of pathogens if a vaccine is available for a disease. Vector and reservoir control. If we can limit a pathogen's reservoir, we can limit the spread. We saw this with New World screwworm and the sterile insect technique. Public education and risk communication. Clear communication helps prevent disease spread, reduces public confusion, and increases their trust. Explaining quarantine and isolation, breaking the chain of transmission to them can help. Of course, encouraging reporting, reducing misinformation and panic are all important. But also, I kind of want like highlighting I want to highlight educating clients about exposure risk because it can be surprisingly effective and takes little effort, and it can be cheap or at no cost, essentially. And so I want to share a story about my twin sister real quick. Let me get a drink of water first, though. Okay, so to give a good example of some easy public education. About a year ago, my twin sister was in her basement getting a canned good from her storage room. And while she was down there, part of the ceiling caved in and showered her with dog food. And sure enough, a rodent had been storing the food in that part of the ceiling where the rodent and there were droppings. And her house is nice and well kept. She's just like that unlucky kind of person where events like this always happen to her. And so it's pretty funny. But the funniest part of the story isn't that she's unlucky, it's that she's a hypochondriac. And so she calls me to vent about this, the dog food and the ceiling caving in on her. And of course, me being me says, "You didn't vacuum it, did you?" And she said, "Of course I did." And so I explained vaguely how to clean up rodent droppings so that you don't get hantavirus, because if like vacuuming can aerosolize it essentially. And I don't even think I said hantavirus because I didn't want to freak her out. And that was probably a year or more ago. But flash forward to 6 days ago, which was good timing for my presentation. She calls me all worried about hantavirus and explains to me in extreme detail about her cleaning methods. So she was out cleaning her camper so they could go camping last weekend. And it was the most thorough and exact way to clean rodent droppings I've ever heard of. Like all PPE listed, bleach ratios, she knew everything. Like everything was more hardcore than the professionals. So long story short, education, it doesn't have to be a detailed class. Just mentioning something like, "Oh yeah, you shouldn't vacuum that," can lead to some pretty effective disease prevention and mitigation measures. So yeah, education can be a cheap and effective tool. And it brings the public on board to help all of us stop the spread of disease. All right, so for this presentation, we're going to focus mostly on surveillance, PPE, biosecurity, and public education and risk communication, especially monitoring and surveillance. And this mouse is in the ceiling. I picked it for my twin sister. All right, so again, the idea is to break the chain of transmission as early as possible in any event. I included this visual so we can see the chain of transmission easier than just me reading and describing it to you. So here, we can see, we have hosts, and then they're spilling over either into us or into animals that we interact with. And then it becomes an outbreak. And then, once we spread, like with airline travel or just travel in general or trade, then it can become an epidemic or into a pandemic if it becomes, in multiple countries. And so all of this whole kind of pathway is the chain of transmission. And so we want to disrupt it the earliest we can to prevent it essentially, like, over here is the most people affected, over here is the least people affected. So the earliest we can do it is how we get the least people affected. And let's see what else. So like here before spillover, things like vector control or surveillance. And then like around here, we could see like isolation, or think like with the pandemic, we had social distancing, vaccination. That's how we can start stopping it if it already spills over. So yeah, so that's kind of a visual for chain of transmission. All right, so what do we mean by monitoring? Public health surveillance. So which is the ongoing systematic collection, analysis, and interpretation of health-related data, essential to planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those responsible for prevention and control. So essentially, we want systematic collection, analysis, interpretation of this data, and then planning, implementation of public health practice, and then getting all of that information and data to people responsible, like lawmakers, and things like that to prevent and control the spread of disease. All right, so and this can apply to more than just infectious disease. It can be environmental threats, chronic disease, even drug use, like the opioid epidemic, for example. But for this, we want to look at it as disease surveillance. But what does that look like? There are several types of public health or disease surveillance. But the three we're going to look at, or sorry, actually four, I added one more. The four we're going to look at are passive surveillance, active surveillance, sentinel surveillance, and syndromic surveillance. All right, so the surveillance types, passive is the collection of data from those voluntarily reporting it, such as hospitals, healthcare providers, parents, or health departments. So like a lab sends us a communicable disease lab report, and then we'll do an investigation on it. So that's passive. Active surveillance involves actively looking for cases, either with a reporting system or using a systematic protocol, such as calling providers seeking reports. Sentinel surveillance is monitoring selected populations, sites, or species that serve as early warning, like an early warning system for broader disease activity. Syndromic surveillance focuses on symptoms, patterns, or clinical syndromes before there is a confirmed diagnosis. And the easy description is passive is routine reporting, active is searching for diseases or cases, sentinel is watching early warning indicators, and syndromic is watching symptom patterns. All right, and some examples. Passive is like reporting a rabies case to us. Active is livestock testing during an outbreak. Sentinel is monitoring wild birds for avian influenza. There are also like sentinel chicken flocks that are monitored for disease, and also insect trapping that we covered in the New World Screwworm slides. That's sentinel surveillance. And then syndromic is tracking, like the example would be like tracking an increase in canine respiratory illness. So we don't know what the illness is, but we know we have a bunch of canines with something respiratory. So that's syndromic. All right, so I wanted to show you more of what surveillance can look like and how we predict and plan for spillover events to occur. Also to show surveillance and monitoring is going on for a plethora of diseases, not just the ones I showed here. There's quite a few. So I'm going to stop sharing for a moment and show you some websites real quick. All right, can you see my screen?
Yes, I can see it.
Okay, sweet. All right, so this is like a ranking comparison for spillover for each disease. And I think there's 889 being watched on just this website. And of course, there's a lot of ways you can filter. We'll just go ahead and click into Ebola. And you can see some of the highlights and like its score. It's third on, like overall. And like human-to-human transmission, we talked about how that's a big risk that we look for, that it's a zoonotic virus, that's a big risk if it distributes in animals. And then you can also click like the full details. And this is where, when I was talking about specifics that we look at in diseases, there's just so many risk factors that they're looking at. So like the geographic, like where it is, like where the hosts are, host plasticity, land use, if we're using the land. There's some others. Oh yeah, this I thought was interesting. The whether or not like even the viral genome of it and whether or not it has an envelope. If it's a pandemic virus that's in humans, there's so much transmission modes. Human, so it's just a lot. And then it shows some distribution too at the bottom. And then we can go look at one more real quick, like rabies, It's not human to human, unless unless some pretty extreme cases, but not necessarily. And then it is zoonotic. What's another good one? Andes virus, everyone's interested in right now. And so yeah, so there's this big website, and you can see out of 880 or 89 viruses. So if you look at this little scroll bar, it just goes forever, and you can see the ranking system of so many different pathogens. So yeah, so that's some work that's going on. Here's kind of who's working on it. The Global Virome Project had a really cool website that showed hotspots. It's kind of locked down under the UC Davis like logins right now, but you used to be able to access it publicly, and I really wanted to show you guys that. But we do have kind of an alternative. This is the WHO's website, World Health Organization, and this is mapping like the risk of spillover pathogens with pandemic potential. So essentially what what our presentation is about today. And so it's on number of pathogens right now, and blue is the highest. And then we can go to like avian influenza to see where that is geographically. Ebola is in the news, so we can see, you know, like the US is unaffected. We want to look at, here's Nipah. We talked about it being in India. And COVID's a good one that we're all familiar with, where it's at. Oh, and plague. Plague I wanted to show because we know that we have plague in Idaho. So yeah, here's some, you know, that's essentially some work I wanted to show you guys that, you know, there's a lot of consideration into pandemic potential zoonotic diseases. All right, and so let me go back to my presentation. Okay, so reporting pathways, of course, we want, you know, one of the earliest transmission kind of interrupters is reporting it to people that know how to interrupt it, or you know, essentially people that know how to contain or isolate, etc. Especially disease specifics. You know, no one can know every disease and what we need to do for each one. So here's some reporting pathways. For communicable diseases, reach out to your local public health district, or if you're in our region, Southeastern Idaho Public Health is who you want to talk to, or us essentially. And that link, that top link, has information on how to report, and it includes the contact for us, StateCom, Idaho Department of Health and Welfare, and you know, just kind of some general information on reporting there. There's also a link to the like what diseases are reportable there. And then for reportable and notifiable diseases in animal health, I included the websites for the State Department of Agriculture and the USDA Animal and Plant Health Inspection Service. Sorry, that is supposed to be muted. And it's here. It might not be a complete list for reporting in your field. I don't directly work in animal health, so I don't know every requirement, so speak to your employer about your job requirements, but I just wanted to include those as some, you know, resources. So common reporting barriers. A lot of reporting just doesn't happen because of certain barriers or uncertainty or et cetera. So we're going to go through some of those and ways to dissolve them. Often it's, you know, uncertainty, time constraints, fear of consequences, limited awareness, and communication gaps. People might say, I didn't want to overreact. I'm not sure it's reportable, or I don't have time, which is probably true for a lot of us. But many of these barriers, like I said, can be solved with little effort or just some encouragement. For not wanting to overreact or being unsure if something is reportable, it's our job at public health to filter this kind of information. So we certainly don't mind listening and figuring out if something that you're seeing is a concern or if it's reportable. Uncertainty, most organizations have their reportable lists on their websites, like the ones I linked earlier. And it never hurts to ask. We don't mind helping to find the appropriate response. Time constraints can be helped by having contacts or protocols readily accessible, or looking into automated electronic reporting with like your EMR or EHR. The time constraints often it takes extra time to get to the point where it's easier, but once you have it almost automated, so you got to kind of put a lot of time up front. And fear of consequences, client impact is a great concern. We emphasize keeping protected health information safe and following HIPAA regulations. Also knowing that reporting protects the long-term health of the individual, of animals, and the community. So we want to prevent situations from getting bigger, and we understand that client impact. Limited awareness can be dissolved through just education, like presentations like these, or talking to your clients. If they bring in their dog and they're concerned about something, just a little education can help them look out for the right symptoms or situations. Communication gaps, reaching out, knowing your partners, connecting to local organizations, and knowing where to report can solve that barrier. And again, public health would rather have too much information than too late information. We want to be proactive in breaking the chain of transmission rather than reactive to outbreaks. So if you're unsure, we don't mind looking into issues or finding answers to any of your questions. All right, and so you're a part of it too. The goal of all of this is to widen the net of surveillance. Everyone is part of the public health surveillance system, including the public. Though those working in fields that include the human-animal interface are particularly important in identifying zoonotic diseases. They're essentially, the front line or the first people that see it. So our veterinarians, animal health workers are often the first alarm or first intervention to stopping the spread of these pathogens. Awareness of pathogens is crucial. Knowing where to report and, of course, educating the public all help to widen the net of surveillance so that we can all protect our communities and our pets. All right, so this one's a big one. One Health is an approach that recognizes the health of people, that the health of people is closely connected to the health of animals and our shared environment. One Health is not new, but it has become more important in recent years. This is because many factors have changed interactions between people, animals, plants, and our environment. Human populations are growing and expanding into new geographic areas. As a result, more people live in close contact with wild and domestic animals, both livestock and pets. Close contact with animals and their environments provides more opportunities for diseases to pass between animals and people. The Earth has experienced changes in climate and land use, such as deforestation and intensive farming practices. Disruption in environmental conditions and habitats can provide new opportunities for diseases to pass to animals. One moment. All right, the movement of people, animals, and animal products has also increased from international travel to trade. As a result, diseases can spread quickly across borders and around the globe. These changes have led to the spread of existing or known endemic and new or emerging zoonotic diseases. One Health is gaining recognition in the United States and globally as an effective way to fight health issues at the human-animal environment interface, including zoonotic diseases. The One Health approach can prevent outbreaks of zoonotic disease in animals and people, improve food safety and security, reduce antimicrobial resistant infections, and improve human and animal health, protect global health security, and protect biodiversity and conservation. Successful public health intervention requires the cooperation of human, animal, and environmental health partners. And by promoting collaboration across all sectors, the One Health approach can achieve the best health outcomes for people, animals, and plants in a shared environment. The World Health Organization has a pandemic agreement that discusses a One Health approach for pandemic prevention, preparedness, and response. And then the US has a national One Health framework that includes many partners like the USDA, FDA, CDC, NIH, and others. So this is the direction essentially that pandemic prevention is going, which emphasizes ensuring your partners here at a local level so that we can all work together to protect our area and communities and help impact the bigger picture in a positive way. I like to think of it as making our corner of the world brighter. So it's, you can see it's people, animals, like environmental health, all working together. So all of us partners working together, coordinating and communicating, and then yay, everyone's healthier. All right. And so paying attention to potential diseases, symptoms, and headlines are good ways to be alert, but it can be a lot and overwhelming, we know for sure. And we also know that communication is a two-way street. So while you're reporting potential pathogens, wouldn't it be helpful to have a system that helps alert you of situations in the area that could benefit your awareness? So the Idaho Health Alert Network, or HAN, is an automated system designed to rapidly deliver time-critical health-related information to designated health partners. When a health threat is identified, the Idaho Department of Health and Welfare sends an email or text to district public health departments like us. And then we pass the information on to hospitals, clinics, physicians, or other appropriate healthcare providers. In addition, information on the HAN website summarizes the event and provides background or guidelines for public health staff and clinicians. And the QR code on the top is the website to sign up if you'd like to join and get these health alerts. And I believe Lori just linked it in the chat as well. So that's a good way to increase your awareness of what's happening around us. All right, another consideration we'd like to cover is preventing the spread of zoonoses in mass care events. Obviously, a lot of people in close quarters together with animals, in addition to low resources, certainly has outbreak potential. So what increases the likelihood of these diseases occurring, and how can we prevent them? I know most of you have seen this slide before, so I won't go into every detail. I do want to point out that our response in mass care situations looks like One Health. So I wanted to emphasize that point that controlling these situations from that perspective is a good approach. The three facets: human health, animal health, and environmental health. Human health, we have things like surveillance, contact tracing, isolation protocols. You see that here. Animal health, we see rodent and pest control, PPE use, vaccination. That's kind of over here. And then, of course, environmental, we have things like making sure we have potable water, hand washing stations, food safety measures. So it looks a lot like One Health already, just because those are sort of our standard prevention measures. All right, so mass care situations are events where we want to be on high alert. There are factors that can lead to outbreaks faster. So interventions in mass care situations is pandemic prevention. And a One Health approach contains prevention measures and is the direction that we should consider. All right, so in summary, be alert, know signs and symptoms of infectious diseases, and which ones might have potential to be a wider threat beyond the individual. Collaboration, know or find your partners to obtain resources you need, like PPE or treatment. Communication, taking a One Health approach and sharing what you see, even if it ends up being nothing. We'd rather have too much information than too late information. Knowing ahead of time can help us prevent the spread instead of reacting to a bigger situation like an outbreak or worse. Remember, we're trying to interrupt the chain of transmission as early as possible. These diseases have many factors that attribute to their spread, and it'll take all of us to prevent them. So using a One Health approach, working together to protect our communities, is crucial in preventing disease spreading events. And lastly, education. Attend trainings and educate your patients and clients, teaching people prevention methods like how to properly clean something like mouse droppings, or the benefits of vaccination, or even avoiding animal encounters can reduce disease burden. Here are sources I use for this presentation. If you'd like any extra information or links to anything that I used, please let us know and we'd love to get you that information. And of course, lastly, thank you for attending. And if you could fill out this survey, it would really help us out here to ensure that we provide useful presentations in the future. So yeah, thank you. And yeah, if anyone has any questions.
So it looks like we do have one question that came through in the Q&A. Do you have any thoughts you can share about the bat that was recently found with rabies in Bannock County?
I know Jeff is on the call and he was the main epi on that bat. So if I can pass it to you, Jeff.
yeah, just at that time of year, the bats are coming out, and it's the recommendation if you wake up with them in your room, flying around, that's a exposure if you're able to catch it safely without having the contact, and then contact animal control, your vet, somebody like that to be able to put the bat down, and then we can do the testing. So, I mean, it's not one of those diseases that's uncommon, stuff like that. I mean, we see a couple every year, anywhere from like 2 to 5 cases probably every year within our district for it. That's, I mean, I don't know what you're looking for on it. So, I mean, it's just part of our surveillance in a sense. So, I mean, if you find a bat that's not behaving right, landing on you, your dog, cat brings it in as a gift, that's not normal things for the bats to behave that kind of way. So it's the ones with abnormal behavior. So like if you're sitting around drinking your coffee in the morning and you get hit across the head with a bat, I mean, a flying bat, not a nice wooden one or something, from your spouse trying to tell you to get up and get doing something. But from, that kind of interaction, so it's those bites and scratches that are more the concern with those from the exposures. Just the normal exposure, the bats flying around, catching bugs. Yeah, we're not going to probably worry about that one too much. You run across a dead bat sitting in a park by itself, we're probably not going to do much with that, because how do you follow up with no known exposures, stuff like that. And then there's certain criteria to be able to do the testing, depending, and then also depending if it's a person to animal exposure, animal to animal exposure, vaccination status. It makes a difference on how much time there is for kind of like the isolation, quarantine kind of period for the animal before, going in to get testing, stuff like that. So there's a lot of ins and outs to them. So the best bet is just to give us a call here at the health department, and myself, Kristin, or Evan, and talk you through that stuff to determine for testing or anything.
Thank you for answering that.
Okay, I was going to just ask, is that what you were kind of looking for, or?
I think that's probably what they were looking for. Does
Okay.
anybody have any additional questions about that or any of the other information that was covered? You can drop that in the chat or the Q&A, or you can also should be able to do the raise your hand feature if you want to verbally ask your question. Not seeing or hearing anything. We will stay on for another couple of minutes since this is scheduled until 2. We do ask that you complete the feedback survey. It really helps us know what we're doing right, what we're doing wrong, what kind of things you might like to see in the future. So the QR code is on the screen right now. I also dropped the link into the chat. And if you don't have time to fill it out right now, if you can just click it and open it and fill it out later, it will be open for a while. So if you can at least download it and fill that out when you have a chance, it really does help us a lot, because we want to make sure that these are useful to our community members. So thank you all for attending, and this will be on our YouTube in probably a couple of weeks. We do have the first session from this series up on the YouTube. So we are a couple weeks out just because they have to be reviewed. So again, thank you for attending. And this concludes this series of emergency preparedness for animal care providers.
Thank you.
Yes,
right,
thank you
guys.
again, Kristin, for presenting
Yep.
twice for us.
My pleasure. It was actually a good experience. So minus my throat.
Yes, thank you all the more.
Yeah, next time I'll be healthy.